April is the month of testicular cancer awareness. And I'm here with Dr. Asante Le Blanc, and we are going to speak a little bit about that. You are the chairman of the Cancer Society of Trinidad and Tobago.
Yes, good morning. Thank you for having me.
Thank you for being here this morning. So let's talk a little bit about testicular cancer awareness. Now, what is the Trinidad and Tobago Cancer Society doing in regards to that?
Well, what we're doing is basically every cancer that every month that there's a cancer awareness for every month,
right.
Different cancers. So what we're doing with Testicular Cancer Awareness Month is mostly education.
Okay.
And you know, because it's not a cancer that's frequently heard about in Trinidad
Correct.
and Tobago.
Yeah, you more often hear about prostate.
For men.
Yes.
Let's focus on the men this month.
Right.
It's usually prostate, colorectal, lung cancer. When you look at the latest statistics from WHO when it comes to Trinidad and Tobago's cancer profile, testicular cancer is actually very low in terms of our population in Trinidad and Tobago.
Right. Do you have any statistics that say why it's that low in Trinidad and Tobago, which is good news for us, of course?
Something has to be good, right?
Right.
No, we don't. But it's mostly seen usually in Caucasians. So that could be one of the reasons.
Okay.
But also, I guess it just doesn't affect our population as much. It's not a very big cancer worldwide either. But in the US, for example, the statistics are 1 in 250 men may be affected by testicular cancer.
Right.
So, you know, it's not that it's not because it's not a big cancer, we shouldn't educate.
So, yeah, exactly. Because,
you know, the thing is, I think the theme this year is Know Your Balls. You know, I mean, it's interesting. But it's for men to become aware of examination, self-examination of their testicles, and understanding when you feel something that you should go to your doctor. And
get checked out. What age group would you say, from what age should men, young men and older gentlemen go to get tested? You know, just, you know, for the sake of finding out whether or not.
So that's the thing. Yeah, I'm glad you asked that because, you know, some cancers have screening tests.
Right.
In this case, it's mostly self-examination.
Okay.
So I think it's important to teach young boys from when they hit puberty and to engage the men as well to do self-examination of their testicles and understand how the testicles feel in the scrotal sac. Because if there's a lump that's abnormal, if there's pain, there's swelling, one testicle is bigger than the other, anything like that, then you should go to your physician. And that being said, there are other non-cancer conditions that can cause this, like orchitis, which is inflammation of the testicles, varicocele, which is like a varicose vein of the testicles. We have hydrocele, which is excess liquid in the testicles, and we have spermatocele, which is a cyst of the spermatic cord. So it's important for you to understand how your testicles feel and understand what you're feeling, and then you go to the physician and he or she will do the examination and then take it from there in terms of imaging.
So when they do the examination, is there a means by which men can be taught how to examine the testicles to determine whether or not there's a lump or some type of abnormality?
Yeah, well, I mean, the scrotal sac has 2 testicles normally. So what men should do is they usually will, it's not clip it, but you'll feel the testicle within the sac. And you just feel along the entire, it's not round, it's like an oval kind of shape. And you just feel along it to see if they're feeling anything abnormal, a lump, a bump, any pain, any excess liquid, anything like that. And then go to your doctor if anything.
Okay, all right, that's very good to know. Also, are there any lifestyle factors that play a role in testicular cancer?
No, the only major one right now is when the late descension of the testes, which is supposed to happen during the embryonic stage of the fetus, and sometimes we have late descension, so that's a possible risk factor. But they're like, and then of course, usual cancer is a lifestyle disease, so smoking, excess alcohol intake, poor lifestyle choices. Those things are all risk factors for all cancers.
For all cancers. So, you know, it doesn't, so even if you're a smoker, it could affect you not only in the lungs, but in other places in the body.
Other parts of the body, for sure.
It increases the risk of it.
Yeah.
All right. So what is the Cancer Society doing? Well, in regards, you said education, are there going to be workshops or seminars or education sessions that are scheduled?
No, this year we're just doing a lot of education via social media. And then because we're also focusing on our fundraiser, which is a raffle that we have. So we're doing a lot of education via social media. We go out in our mobile clinics, we educate about testicular cancer, and we may schedule some examination clinics. We're looking into that to show men how to do it. Maybe we'll do a segment on that. So that's what we're basically doing for testicular cancer.
A lot of education, yeah, because
education is key, because this is a cancer that does not have screening.
Right.
So it's about, your screening is your self-examination. So education is important, because you have to know your body as men and young boys, understand your testicles and not be fearful of it, and really understand when you're seeing something different and what to do, and not be fearful of that. Definitely.
Dr. Asante Le Blanc, I want to thank you so much for joining us this morning and giving us some education in regards to this, and and keeping us updated as to what the Cancer Society of Trinidad and Tobago is doing for Testicular Cancer Awareness Month. I want to thank